Hi, I am Dr. Julie Brown, your concussion doctor, diplomate in chiropractic neurology, and fellow in traumatic brain injury and rehabilitation. Today we're going to talk about concussions, and a concussion is a biomechanical or a functional change in the function of the brain. And first off, I want to address some misconceptions. One, that you have to get hit in the head, and two, the other misconception is that you have to lose consciousness. Neither of those are true, and we're going to go into why that is the case. So we have this we have a head, but we have this brain floating around inside. So if you think of an egg and you shake it, an uncooked egg, that yolk is going back and forth in the brain, in the egg. The same is going to happen for your brain. They talk a lot about coup, countrecoup, meaning if you got hit here, your brain went here and it went back and forth here, so your damage is here. Yeah, there's that, but there's more research that's related to the brain stem, which is in the middle. If I could just get right in the middle. And when that brain whips all around and is not anchored down, because it's not anchored down, there's no amount of neck muscles that is going to make your brain stay where it's supposed to. The brain stem gets this torquing motion. So if you take a washcloth and you're wringing it out, it's the inside that gets most of the torque. Now, understanding neurons do not like tension or compression, and that is tension is a big thing that's happening in there, and if it squishes, that'd be compression. You also have little blood vessels in there that deliver fluid to those neurons, and they also get torn and irritated. So take a car accident, for example. Simple hit, forward here. That brain is doing all sorts of twisting in the skull. So the appropriate way to evaluate for concussion, it's not really seen on imaging. Very few are ever seen on imaging, and usually what's seen is this little, in the temporal lobes, they can get cut on the bone, and sometimes that can show, but I have many patients with symptoms that don't show that on the imaging. So the appropriate way is to look at eye movements, because they're one of the only things that uses the entire brain, and there are 6 different types. The second one is balance. So we test balance with head turns, head, neck, extended on a foam, and also evaluating gait, the way someone moves when they walk. Those are full brain activities, and by evaluating those, we can localize where those problems are. I'll continue on in another video on how we support concussion or rehab concussion. So for right now, if you'd like to know more about my office, below is a link to my website, and then over here you can click to the YouTube subscribe channel right here.